Hello everyone my dear friends. I am Dr. J.D. Gupta. Today we will talk about normal and abnormal ovarian ultrasound reporting system. First of all features in normal ovaries. Ultrasound examination of both ovaries shows normal size and shape without evidence of any abnormal masses or cysts. Both ovaries have a homogeneous echo texture with multiple small follicles, consistent with a normal premenopausal appearance. Next talk about simple ovarian cyst. Ultrasound examination of the pelvis reveals a well-defined cystic lesion in the right ovary. The cyst has smooth walls and is filled with fluid. There is no evidence of any solid components or septations. Next one talk about hemorrhagic ovarian cyst. Ultrasound examination of the pelvis shows a cystic mass with internal echoes in the ovary. The cyst has thick, irregular walls and multiple septations. The internal echoes are consistent with blood products, indicating a hemorrhagic ovarian cyst. No free fluid is noted in the pelvis. Next one talks about endometrioma. Ultrasound examination of the pelvis reveals a well-defined cystic lesion with a ground glass appearance in The cyst has a thick, echogenic wall with diffuse low-level internal echoes, consistent with an endometrioma. No free fluid is noted in the pelvis. Next one talks about serous cystadenoma. Ultrasound examination of the pelvis reveals a well-defined thin-walled anelocular cystic lesion in the ovary. No internal flow is detected within the lesion on color Doppler. No free fluid is noted in the pelvis. Next one talks about serous cystadenocarcinoma. Ultrasound examination of the pelvis shows a complex cystic mass measuring in the left ovary. The cyst has thick, irregular walls with solid components. There is also evidence of ascites. These findings are highly suspicious for a serous cystadenocarcinoma. Next one talks about mucinous cystadenoma. Ultrasound examination of the pelvis reveals a well-defined cystic mass in the left ovary with thin walls and internal echoes. The cystic mass appears to be multiloculated with thick septations and internal debris, consistent with a mucinous cystadenoma. No free fluid is noted in the pelvis. Next one talks about mucinous cystadenocarcinoma. Ultrasound examination of the pelvis shows a complex cystic mass measuring in the left ovary. The cyst has thick walls, internal septations, and solid components, with evidence of internal vascularity. There is also evidence of ascites suggestive of mucinous cystadenocarcinoma. Next one talks about dermoid cyst. Ultrasound examination of the pelvis shows a well-defined cystic mass in the left ovary with internal echoes and calcifications. The cystic mass contains heterogeneous internal echoes and speckled debris, including fat and hair, consistent with a dermoid cyst. No free fluid is noted in the pelvis. Next one talks about ovarian metastases. Ultrasound examination of the pelvis shows multiple irregular solid masses with irregular borders in both ovaries, measuring up to 45 mm in diameter. The masses have internal vascularity. There is also evidence of peritoneal nodularity and ascites. Next one talks about parovarian cyst. Ultrasound examination of the pelvis shows a well-defined cystic mass adjacent to the right ovary, measuring in diameter. The mass is separate from the right ovary and has thin, smooth walls with no internal vascularity. Next one talks about polycystic ovarian syndrome. Ultrasound examination of the pelvis shows bilateral enlarged ovaries with multiple small follicles arranged in a peripheral distribution, giving the appearance of a string of pearls. The right ovary measures X and contains 12 small follicles, with the largest measuring in diameter. The left ovary measures X and contains 14 small follicles, with the largest measuring in diameter. Next one talks about ovarian hyperstimulation syndrome. Ultrasound examination of the pelvis shows bilateral enlarged ovaries with multiple cystic structures measuring greater than 3 cm in diameter. The right ovary measures 60 mm by 50 mm and contains numerous cystic structures with internal septations. The left ovary measures 60 mm by 55 mm and also contains numerous cystic structures with internal septations. There is mild fluid in the cul-de-sac. Next one talks about ovarian torsion. Ultrasound examination of the pelvis shows a right ovarian mass measuring 40 mm by 38 mm with a twisted vascular pedicle. The right ovary is enlarged and there is absent or minimal blood flow on color Doppler imaging. The left ovary is normal in size and appearance. No free fluid is noted in the pelvis. Hello my dear friends, please like, subscribe, share and press the bell icon for the first notification.